I love to hike. I love being outdoors and camping. I'm an artist. I paint and actually have been represented by a few galleries. But right now I'm doing ceramics and I have a kiln and a wheel in my basement and an art studio, so I spend a lot of time in the studio. So I grew up in a pretty intellectual household. Someone who was always going to be a doctor, lawyer, engineer. So my mom, a school counselor, showed me or talked to me about the University of Missouri, Kansas City Med School, and I thought, wow, what a great idea. I love biology, so I did it. I had no backup plan, and off I went. So decided really young, it's kind of a cliche, but that's how I started. But if you ask me now, at this age, I'd say, what a better profession where you can make a difference in the world. So that's really important to me. So every day you get to make a difference, and that's why I love being a physician. I told my children when they went off to college, find what you're interested in, what you excel at, and your passion will follow. And that's what happened for me. I went to med school and was open to everything. And then I got to peds and really excelled at it and loved it. And it really became my passion. And I love peds. There's such a diversity in pediatrics. You see newborns, infants, teenagers, even young adults when they're too afraid to move on. I really love guiding parents through their child's or their children's ups and downs through the years and calming their fears or just giving them the confidence in the decisions that they're already making. So yeah, so it's a beautiful thing to be a part of that. Preventative care, it's really important to screen early to look for developmental delays, autism, learning issues, and get kids treated and diagnosed and treated as early as possible. But I'm really passionate about our preteen and teen kids. I really want them to access care as much as possible, to help empower them, give them the confidence in their bodies, in making decisions about their health, and really focusing on, anxiety and depression and guiding them through screening for that, finding help, and medicating if we need it, and really their gynecological needs, which we tend to ignore a lot in the teenagers. So I do focus a lot on that. I would say most rewarding about being a pediatrician more is, the smiles you get every day. The kid who gives you a hug, the kid you tell that they don't have to get a shot, the one who is excited to see you. They're really excited to see Dr. Krahn. The teenager who's really anxious about talking to you and comes out feeling, wow, I got that all out, that was okay. So what's rewarding is just being a part of all of that, to making a difference in someone's lives every day. I've lived in a lot of countries, traveled a lot, and it's always made me really aware of people's backgrounds, their different cultures. So I really try to bring that to my practice too, is being aware of where someone's coming from, being aware of their culture, their background, and being open-minded to why they make the decisions that they make. So my philosophy would be to treat everybody and respect everybody equally. I'd also add, when it comes to diagnosing and treatment, I always use evidence-based medicine, using the latest data, scientific data, to help guide me in my decisions.